I've become accustomed to doing this, and I know many of you have as well. It's a time for us to be together and for me to share with you some information about where we are in our continuing fight against the coronavirus here in the state of Rhode Island. I want you to know that I feel that we are absolutely headed in the right direction. I can't say I feel good about things because there's not a lot to feel good about. But when I think about what we've done together in the past month to deal with this crisis and ready our system and now beginning to ready ourselves to get back to work, I feel proud of so many people. I feel that we've done about as good of a job as we could have keeping everybody safe. And I feel so grateful to each and every one of you who is sacrificing and leaning in and being generous to help us all get through this in the safest, best, quickest way possible. So as we end another week, or it's a Friday here, I just want to say thank you and let you know that I feel strong and confident and hopeful about what lies ahead. Having said that, you will see the numbers on the screen, or will be on the screen shortly. We're still in the upswing here in Rhode Island. Our cases are still continuing to go up, deaths still going up, hospitalizations still going up. I hope that soon we can start to, turn the corner and get ourselves on the downswing. I know that all of your hard work has helped us to flatten the curve, so it's not going to be as bad as it would have been. And if we just hang in there for these next couple of weeks until May 8th, it is my hope that by that time we will be on the other side of the curve and on the downswing. So hang in there. And again, don't be alarmed by the numbers that you see on the screen. We're still climbing, but not in a way that is surprising. Having said that, it's no less difficult for those who have lost a loved one or who are sick themselves. So our thoughts and prayers and hearts go out to all of you. I want to start, before going through some of the official announcements, I just want to start for a second with a message of hope. And the fact of the matter is, as the days are dragging on, one of my staff members said yesterday that we should wear different clothes to let ourselves know which day of the week it was, because every day feels about the same and every day feels like a Monday. And, that's tough, right? Like, every day bleeds into the next. We don't know when it's going to end. We don't know when we're going to go back to school or back to work. I do not want to minimize that. The physical challenges, the financial challenges, the mental health challenges, it's real. It's real. It's getting tougher. And by the way, it's for everyone, in my family and yours. But here's what I do know. It's not going to last forever. It's absolutely not going to last forever. There is another side of this, and we're going to soon get to the business of getting back to normal. Now, it's not going to be the way it was probably for at least a year until we have a vaccine and until we have some really excellent therapies. But it's going to start to feel a little more like normal. And that's something we can all look forward to. And in the meantime, the thing that gives me hope is the everyday expressions of kindness, creativity, resiliency, and bravery and strength that I see. And I mean every day. And usually when we think of someone being brave, we might think of a first responder or somebody in the military. And by the way, they are brave. We have nearly 1,000 members of the National Guard being brave every day at our swabbing centers or setting up hospitals, and I want to thank you for that. Our healthcare workers are the bravest among us right now. God bless you, truly, and thank you for your bravery and your strength and your courage and your stamina. It's harder than ever, and we're right there with you. But also I think about, the couple who's trying to co-parent their kids, and it's hard. Maybe the children are with mom, and dad is going to work and delivering groceries and occasionally seeing the kids. That's really hard. is hard. It's hard for mom who's cooped up in the house, and it's hard for dad who doesn't get to see his kids regularly. So you're brave and you're courageous and you're strong. Or I think about someone who's going way out of their way in order to help their neighbor, even though they might not have enough themselves. But they're finding a way in their heart and in their wallet to share a little bit. And on and on and on. Every day it's happening. It's courageous and it gives me hope. And the fact of the matter is, we're going to get through this. And I think we're going to get through it. It won't be without a great deal of suffering and loss and hardship. But we will be stronger and more resilient on the other side. And so I find a great deal of hope and strength in the selflessness and courage and hopefulness that I see every day, and I see it even online, some of the ways folks are trying to help each other. So hang in there a bit longer and know that at least on my team, we are doing everything we know how to do and working as hard as is humanly possible every minute of every day to get through this as fast and as safe as possible, and to support you financially and every other way every day between now and when we get to the other side. To that point, I have had a lot of, to the point of providing support to people in order to get through this. We've gotten some questions recently about supports for workers who have contracted the coronavirus, potentially at work or in the line of duty. And as I said before, this is an especially difficult time for everyone, but most especially for our healthcare workers. Doctors, nurses, therapists, CNAs, custodians in hospitals and nursing homes, etc. And so today I have, by the way, said all along, there's been so many companies in Rhode Island who've been fantastic. I won't list them all, but either giving charity or keeping people employed or whatever they can do. Today I want to recognize one such company, which is Beacon Mutual Insurance Company. Beacon Mutual Insurance Company is the predominant provider of workers' compensation insurance in Rhode Island. They insure over 12,000 Rhode Island businesses. And I'm announcing on their behalf today, we've been working with them, that Beacon will be allowing frontline healthcare workers to file for workers' compensation under the presumption that they contracted the virus in the course of doing their jobs, and Beacon will expedite those claims. That includes doctors, nurses, EMTs, home health care aides, and others. So I want to thank Beacon for stepping up and doing the right thing, because it's the right thing to do. And if you fall into that category, if you work in a healthcare institution or EMT or a home health care worker, and you've unfortunately contracted the disease, you'll be presumptively assumed to have gotten it in the line of work and therefore eligible for workers' comp from Beacon Mutual. Now, I do want to remind you that this is an additional benefit on top of the coronavirus TDI, which we have made available, the unemployment insurance benefits, the pandemic unemployment assistance, and the TCI that we're providing. So there's a number of different benefits available if you have either lost your job on account of coronavirus or if you've contracted the disease on account of your job. A few other points. Yesterday I provided a model showing what the disease might look like here in Rhode Island in the weeks to come. And as I said then, it obviously, depends on how successful our new regulations are and how much each and every one of us obeys the stay-at-home order for the next couple of weeks. But our goal the whole time has been prepare for the worst, work for the best. And so along the lines of preparing for the worst, I've had a team spending the past 5 weeks preparing our state for additional surge capacity in our healthcare system if our hospitals become overwhelmed, as we unfortunately have seen certainly in Italy and New York City, Louisiana, Washington State. Unfortunately, in those places they peaked sooner, and it was pretty much impossible to get ready for the surge in the hospitals. I'd like you to know that your hospitals here have been fantastic. They are ready, and they have worked collaboratively over the past month with my team to make sure that we can handle a surge if and when it comes. Specifically, I want to thank our hospital leadership who have put forth their own plans, which we've approved, to increase their collective capacity by almost 250%. The team, my team, working with hospitals, has been led by an unbelievable woman named Daisha Reed, and her team has more than 50 people. It includes personnel from the National Guard, Emergency Management Agency, Department of Health, and the Department of Labor and Training. It also includes hundreds of construction workers, architects, electricians, security guards, housekeepers, medical suppliers, and on and on. You can imagine everything that it takes to establish and run a new hospital. And you know, I feel it's important that you know, first of all, that it's going to be safe. It'll be safe. We are ready. We're working our tail off every day, and so are you, by staying home, so that we never get into a situation, and I don't think we will get into a situation where we need 3,000 hospital beds. But if, God forbid, we do, we're on it, due to the hard work of so many people who've shattered records to make sure hospitals are ready for a surge and we have backup hospital beds. They've done this, when I say shattered records, in record time. To put this in perspective for everybody, it was only about 4 weeks ago that the Army Corps of Engineers landed here in Rhode Island to start looking at potential places where we might have field hospitals. Just a few weeks ago that I was fielding questions. Can we get the Army Corps to come here? Are there extra facilities? Will we be able to, you know, have extra hospital beds if we need them? And I said to you then with confidence, yes, we have a plan, we have a team, and we're on it. And I want you to know that in these 4 weeks, due to a lot of hard work, we, in a couple of weeks, will have the capacity in 2 field hospitals, one at the Convention Center and one at the former Citizens Bank complex in Cranston, for over 1,200 new beds. And I cannot thank the leadership at Lifespan and Care New England enough. They have been collaborative team players working with each other and with us to make this happen, and to make sure that if and when we need to open these hospitals, they will be staffed. I also want you to know we use the word field hospital. I've heard sometimes in the media makeshift hospital. That's, I think, maybe a misnomer. You know, these are really excellent facilities, places you will be able to be cared for and get better should you become sick. So thank you to everyone who's been part of that great work. On the theme of working for the best but preparing for the worst, we also need to be ready if we get to a place where there's a shortage of medical equipment or supplies or medicine in the event that we are overwhelmed. I want to be clear, I don't think we'll get there, but we need to be prepared just in case we do. So later today, the Department of Health is issuing guidance, and we're asking all of the hospitals to adopt this guidance in their planning around ethical guidelines and guidelines for crisis standards of care. A great deal of thought has gone into these guidelines. Dr. Alexander Scott, her team, ethicists at Brown Medical School, in partnership with Lifespan Care New England. It's his excellent work just to make sure we are ready if we get into a place where we have to make difficult decisions around provision of health supplies and hospital beds. Finally, I want to give a huge shout out and a thank you. I have been up here day after day asking you if you are a healthcare worker who's working part-time or retired. I've been asking you to go to riresponds.org. You know, it's one thing to build hospital beds and for hospitals to have surge capacity, but we also have to staff them. So you should be very pleased to know that since I've started asking for folks, more than 3,300 healthcare professionals, physicians, nurses, CNAs, and the like, have already gone on to riresponds.org to join our state's response. It's incredible. I'm grateful. Again, it gives me hope and confidence, especially as I now spend my days thinking about how to get people back to work, how to get kids back to school, and to do it safely. I need to know that if we start to have more cases, we'll have the staff that we need to keep everyone safe. So if you have if you are a healthcare worker who wants to serve and you haven't yet signed up, riresponds.org. If you're one of the 3,300 who has, thank you. Thank you. I wanted to say another thing about personal protective equipment, all on the same theme. You know, we have to make sure we are ready for whatever comes our way. About a month ago, or I guess a month and a half ago, I reached out to Steve King. Steve runs Quonset Development Corp. He's largely responsible for the terrific innovation and growth of Quonset. I called him. He's an expert in logistics, former military, and has been a valued member of my team from day one. I called him late one night and said, Steve, I need you to run our supply chain on PPE. That was a Saturday night. Sunday morning, he was in the office, and he hasn't stopped working since. He manages a team of probably 20 people, many volunteers, trying to make sure his goal is to make sure we have a 30-day supply of PPE on hand at all times. We're not there yet, by the way. That's, I'm sure, going to be the first question. I'm hoping in a week-ish we'll be there. We're still struggling to get everything we need, but that's the goal. And that means even when we hit the peak and start to come down and maybe go up again at some future time, we'll always have 30 days of PPE in our own kind of Rhode Island stockpile. That is gloves, masks, gowns, surgical masks, ventilators, and on and on. So I want to thank Steve and his team for their work. We're not out of the woods yet. It's still a struggle. We're still competing with other states and with the federal government, but it's starting to come in, and I wanted you to know the gold standard, we think, is 30 days on hand at all times. To give you a feel for the magnitude of what we're talking about, in just the last week, we've received just over 1.2 million surgical masks, 1.5 million gloves, and 10,000 face shields. We've placed additional orders for more than 10 million surgical masks and another 1 million N95 masks, tens of millions of gloves, and hundreds of thousands of gowns and face shields. I want to take a second to thank the 240 businesses in Rhode Island that have each stepped up to donate supplies, and I want to acknowledge Apple and the New England Patriots, each of whom donated to us about 100,000 K95 masks. And I want to acknowledge Louis Yip of the Rhode Island Association of Chinese Americans, who's donated 200,000 surgical masks. So if you're out there and you're a healthcare worker and you're frustrated that you're having a hard time getting access to PPE, help is on the way. because we're finally starting to see the supply chain open up, and that magnitude of what we're ordering should give you some sense that it's going to get a little bit better every day, and know that that's what we're working towards. In the meantime, I wish you didn't have to reuse your masks, and I wish it weren't so difficult. And again, I'll say you're truly the heroes of this fight, and I'd ask everyone to continue to be brave. Continue to be brave. I will say, good news, we're just a couple of days away from deploying the Battelle system in Rhode Island, which allows us to sanitize thousands of masks at a time so that they can be safely reused, the N95 respirators. And that, once we get that up and running over the next few days, that again will be a huge relief to the system. The question that is top of mind for me, of course, is when can I get everybody back to work? And I'm trying to figure out when that is. I'm going to have a lot to say about that next week. But the reason I'm focusing now on hospital beds and PPE is because those were all the necessary conditions that I had to have in place before we can think about safely reopening our economy.